In a recently unsealed lawsuit, the U.S. Department of Justice has accused Woonsocket-based CVS Pharmacy of unlawfully dispensing controlled substances and seeking reimbursement from federal health care programs. Prosecutors also allege the company set staffing levels in pharmacies so low it was impossible for pharmacists to comply with their legal obligations and meet CVS's demanding metrics. Boston Globe Rhode Island reporter Gavin recently wrote about some of the employees' complaints regarding working conditions at CVS that were included in this lawsuit. Chris, thanks for being here.
Thanks for having me, Kim.
So let's start with this. What were employees saying about their working experiences at CVS? What did you learn from this suit?
Well, primarily, these pharmacists and other workers felt their stores were understaffed, but said they still had to meet corporate performance benchmarks, according to the lawsuit. They feared that taking together these conditions jeopardized patient safety and warned that at worst they could prove fatal. So CVS executives had received hundreds of complaints through what prosecutors said were an internal ethics line, but that those complaints mostly went ignored. For example, one employee claimed staffing levels were so low that pharmacists were not able to have basic human rights, in his words, such as having bathroom breaks. Prosecutors even said one pharmacist developed a urinary tract infection after not being able to use the bathroom during a 13-hour shift. Another actually said they vomited on the side of the road after a shift after they weren't able to eat all day while at work.
Wow, quite some alarming allegations indeed in this suit. Now, you mentioned these performance metrics allegedly set by CVS that these workers were trying to comply with. Can you tell me a bit more about what those were and how they worked?
Sure. The lawsuit alleges CVS developed these labor standards, including specific time frames for how long it should take them to do, various jobs or tasks rather on the job, including filling these prescriptions. Prosecutors, however, said that these standards were not assessed on whether pharmacists were actually able to perform that work within their legal and professional or ethical obligations. They also said employees could face discipline or negative job reviews if they didn't fill prescriptions quickly enough. Another one of those standards was the volume of prescriptions filled. Those who filled or succeeded volumes were able to get higher bonuses, according to the lawsuit. One employee admitted they often blew through computer alerts that identified dangerous prescription combinations because they could, quote, barely stay afloat. Another said safety issues could arise when one is, quote, rushed to fulfill an order like McDonald's.
Wow, that's really alarming, comparing filling prescriptions to working at a fast food drive-through. Obviously, some strong allegations here. What is CVS saying in response to all of this?
Well, CVS has pointed out that each of the prescriptions in question in the lawsuit were, prescribed by government licensed practitioners.
Sure.
The company has also vowed to vigorously defend itself in court and has argued what authorities are basically saying authorities that are seeking to impose a, quote, shifting standard for pharmacy practice. And then as for those workplace conditions, Kim, CVS said it works to ensure, quote, there are appropriate levels of staffing and resources in pharmacies and makes investments to address employee feedback. A company spokesperson told me CVS is in a better place than it had been in recent years and is now actually seeing improved customer and colleague satisfaction. I.e. lower turnover than it had since before the COVID-19 pandemic.
This is just getting started, this story. I'm sure we'll be covering it closely throughout the coming weeks, months, and potentially years. Gavin from the Boston Globe, Rhode Island, thanks so much for being here.
Thank you.